this poster was the final analysis of RIFTOS, which was a global non-interventional study assessing the use of multi-kinase inhibitors for the treatment of patients with asymptomatic radioactive iodine refractory thyroid cancer. So this study came about because when the original phase 3 studies for both sorafenib and lenvatinib were launched, they allowed for patients to have lesions as small as 1 centimeter because that was the RECIST criteria as far as measurable disease. However, there are patients who have lesions that are small that are also asymptomatic. And so the question was raised, how do these patients do? How do they fare? And overall, mostly what this was designed to do was to tell us what's the real world experience of patients who are treated with RAI refractory thyroid cancer in the community. The one caveat with this study being that these patients were all asymptomatic. So it doesn't include the patients who are already having shortness of breath or bone pain from other regions of their disease. So the primary information from this is to say that we have basically enrolled a little over 650 patients in total. Little under 200 of the patients were treated with lenvatinib at some point or early on when they were started, and then about 200 were actually treated with sorafenib. And the way the design went is to be enrolled, you had to have RAI refractory progressing disease that was at least 1 centimeter and asymptomatic. And then it was a choice by the practitioner whether or not they were going to start the patient on a drug right away, or whether or not they were going to hold off on treating them until later in their course for whatever reason, either waiting for more progression or waiting for symptomatic disease. And so patients were then assigned to 2 cohorts. One was either the watch and wait initially, or one to MKIs initially. And so these patients were then followed from that point on. Overall,